So my name is Trenton Schmale. I'm a fourth-year medical student at Marian. I've been involved with the Indiana State Medical Association for since I was a first-year medical student. Last year we had a presenter, Dr. Meg Edison, kind of talk about her involvement in her state medical society. And it kind of really encouraged me to continue what I was doing and maybe take it a step further. So I felt like I could also contribute more at a state level than national level. Just being more local, I feel like I have more of a say in what I'm doing. So before medical school, the 2012 presidential election, I was doing my master's at the time, had a really big impact on me. Ron Paul, if you're not familiar, was kind of a doctor that really had a different perspective on things in policy, and his ideas really resonated with me. So I wanted to kind of continue on his ideas, and I thought the best way of doing that was just getting involved locally in my state medical society or just like local politics in general. So I kind of followed his ideas, and that's what got me interested in politics. My first year of medical school, I was the ISMA, so the Indiana State Medical Association, represents or votes on a couple representatives from each school or each campus. And so IU has like 7 or 8 campuses, and then Marian, being a new school at the time, had a campus. And they took 2 representatives, and there were like 10 people that ran. I ended up getting probably dead last for all I know. I didn't win, but with that said, I didn't want to let that define me. So I still attended the ISMA/AMA monthly med student section meetings. I didn't really have a lot to say at the meetings, my first few, but it was just a way for me to be involved in healthcare policy with medical students that were also interested in the same thing. And then after going to these meetings for 4 or 5 months in a row, they had a physician leadership conference, and I thought that would be a great opportunity to meet local physicians. And so I went to that, met the Secretary of Social Services for Indiana, got to talk to him. It was just great networking opportunities. But my lesson for first year, and some of these are going to be preaching to the choir for a lot of you guys, but pursue what you're interested in. Don't let someone tell you can't do something. If you're really interested in it, you'll go out of your way to do something that you really love. And for me, that is just healthcare policy. So my second year, I was an alternate delegate at the ISMA convention. So this was the first convention I had really been to, and it was a great learning opportunity to kind of find out how resolutions were passed, became ISMA policy, and then how the ISMA then went on to lobby for the state legislators for these ideas or these resolutions. So it was a great learning experience. I didn't really do anything other than sit and learn and watch how everything happened. But with that said, I met a lot of great doctors. My lesson for year 2 is it's a great opportunity to make connections locally in your future profession. There were a couple doctors that I met that first convention that I then worked with the next couple years to kind of bat ideas back and forth on different resolutions, and I kept in contact with them all through my 3rd and 4th year as well. One of those doctors I was working with ended up being a program director for a residency program that I then interviewed at 2 months ago. So, I mean, you really meet physicians that are, they have a big kind of sway in local politics, and it's just great meeting them. Again, I continue going to the monthly meetings. It's just a great opportunity to kind of be with medical students and kind of meet them and kind of get their perspective on where they would like to see things going as well. My 3rd year, I was a delegate at the ISMA, so I was able to vote on different resolutions. And this was a big thing because there were only 4 or 5 medical students in the state of Indiana that were able to vote on some of these resolutions. And, in the grand scheme of things, you have 4 or 5 medical students voting in a huge body of like 130 physicians. We don't get a big say, but the fact that we get a vote, I think, is a pretty cool. I also sat on the Socioeconomic and Regulatory Reference Committee. And in these reference committees, they are assigned about 10, 11 resolutions. And, you have the authors of these resolutions come and present and talk on why they believe this resolution needs to be passed, and you hear counter arguments from other physicians. But then we go into a closed meeting afterward, and we decide on if these resolutions should be amended, if they should be passed, if they should be rejected, or if they should be moved to a study by the Board of Trustees. And it's really interesting being behind closed doors with 4 or 5 other physicians, and we're kind of like the ones deciding, what do we recommend the ISMA body to do with these resolutions. And you hear a lot of interesting topics. The first one, third year, that was really interesting was maintenance of certification. We talked a lot about that. A lot of doctors in Indiana were very much against maintenance of certification, which I think some physicians here probably hold those same ideas. GME was another big issue, and so right now there is a shortage of residency spots in the United States, and Indiana now has a brand new school, and there are a shortage of residency spots in Indiana. So there was actually a medical student the year before me that put forth a resolution trying to get the state legislature to fund more residency spots. So that bill got brought up, and that ended up passing. And so this year they're actually working on getting new residency positions to Indiana. I think they're working on getting 100, so it's going to be huge for Indiana. The Interstate Medical Licensure Compact is another big issue and continues to be a big issue. And then opioid prescribing. In southern Indiana, there's a huge HIV epidemic or outbreak because of people using IV drugs and sharing needles. So that's been talked about a lot as well. I was also on the ISMA Commission on Constitution and Bylaws, and this was a commission that we met once that year. And it was right before the convention, and we just talked about any resolutions that involved the Constitution and the bylaws, and we just kind of talked about that. It's just a kind of great way to kind of stay connected with some physicians in the network or in the association. And once again, continuing to go to the monthly meetings. I think that's really important because the more meetings you go to, they kind of get to know who you are. When you vote on if you're going to be in a commission, they're willing to vote for you because they know you're passionate about healthcare policy. They know you'll attend the meetings, and so it's just important to go to those. They also the ISMA started up a new program where they have classes, and these classes are specifically for physicians. I went to one called Pricing Strategies. I was with 6 or 7 other physicians, and we were learning from a dean at Butler's MBA program on just pricing strategies and kind of like the economics behind that. And the physicians I'm with are, presidents of health networks or independent physicians, and it's just great talking with them, learning economics with them, and just kind of spending that time together. The lesson I learned third year is there are many opportunities to be active as a medical student in your state medical association. It's about going and finding these opportunities to be involved, and it's just a great place to kind of continue your interest in healthcare policy being in these associations. My fourth year, I was once again a delegate at the convention, and I put forth a resolution, Resolution 1641, which is on direct primary care. I'll explain that a little bit more in a bit. I also sat on the Socioeconomic and Regulatory Reference Committee again. A lot of the same issues were talked about. And then currently I'm on the ISMA Commission on Legislation. And this is a really interesting commission because it's only in session, or we only meet when the state legislature is in session. And so what we talk about, we have like a round table of probably 10, 15 doctors along with lobbyists for the ISMA. And we talk about any Senate bill or House bill that is going to be affecting healthcare in Indiana. And this is a great opportunity to kind of hear what's going on in Indiana, like front of the line, and learn about these new issues. We had a state senator come in and talk about, all his bills that he was putting forth. And, so it's cool that you can meet the state senators. So recently there's a Senate Bill 303, which is on direct primary care agreements. And when it got brought up in the last meeting, so the last meeting was like a week ago, when it got brought up, there were like 3 or 4 physicians at this table that didn't know what direct primary care was. And this was a great opportunity for me to talk about direct primary care and some of the issues that are going on federally right now, and even state-wise on like how we can get doctors into direct primary care. And so I got to talk on that, and I think a lot of people were really surprised that the one person talking on this was a medical student, when a lot of the physicians there had been in practice, 20, 30 years and didn't know about it. So I thought that was pretty neat. At the end of March, I'm scheduled to possibly testify for the ISMA on the state legislature if they need a physician or in this case a medical student to talk on a specific policy or a bill that's going to be voted on that day. They're going to call me up and I'll get to go testify. So I think that's pretty neat. Once again, going to the monthly meetings, I think that's a big thing. My lesson for fourth year was don't wait for opportunities to arise, create opportunities for yourself. If I would have waited to see if a direct primary care resolution would have came forth for the ISMA, I probably wouldn't have got to be able to talk about it in, during medical school, possibly even residency. So if I created the resolution on my own, knowing I'd be able to testify on my own in front of the ISMA and talk about this and kind of get it a talking point for the ISMA in the future. I'm hoping to practice in Indiana after residency, and if we have a resolution that is supporting direct primary care, that just helps me out in the long run, along with physicians that are interested in doing the same thing. So my resolution 1641, resolutions are a big list of whereas statements followed by resolves, and these resolves are what you hope to achieve from the resolution. My first resolve for the resolution was that the ISMA seeks state legislation defining direct primary care to be outside the scope of state insurance regulations. This is important. Currently, to my knowledge, and Dr. Gunther may know a little bit better than I, but there are 13 states that have allowed or that have passed regulation like this, keeping direct primary care out of the scope of insurance regulation. If DPC gets regulated like insurance, it's very counterproductive, because then they have to get the insurance licensure, and they have to go along with all the regulations that go with that. So that was kind of a big point for this resolution. The other resolve was that the ISMA work with the AMA to seek federal changes to Internal Revenue Code 213D and 223C, allowing health savings accounts to be used with DPC, and they're considered a qualified medical expense for flexible spending accounts. This is an issue nationally more than statewide at this point, because people can't use their health savings accounts or flexible spending accounts for direct primary care. So a lot of people just see, okay, DPC, it's a great thing, but if I still have to be putting out money for this monthly, it's kind of like a burden on me when I already have the insurance, I have a health savings account. Why would I want to be throwing out more money? So the interesting thing about that is, I'm not sure if you guys are familiar with Rand Paul's plan. He just put it out about a week and a half ago, but it addresses this issue, and I really think that's pretty neat, and I'll be interested to see where Rand Paul's plan goes. The last resolve was that the ISMA seeks state legislation creating a mechanism to allow Medicaid patients to use direct primary care practices. This is something that Q-Liance in Washington has been kind of testing, and they've been fairly successful to this point. They put out data in 2015, I think, on their 2013-2014 results, that they were able to save, they were looking at their patients and comparing their patients to patients that didn't use Q-Liance, and they were able to save those patients about 20% on all their healthcare expenses. They were able to increase their primary care visits, decrease their ER visits, decrease their inpatient stays, decrease their specialist visits, and decrease advanced radiology. And they had a 95 or 96% patient satisfaction score, which nationally was just crazy for them. So I think that would be another great idea, and it would be able to help save the Medicaid program that Indiana or other states have, being able to help these patients and reduce their costs long term. With that said, the resolution got moved to study, so I have to wait till next year before I hear what the board decides that they want to do, and then from there, hopefully I can get it passed next year. Things to look into. This is kind of what Dr. Haynes was talking about earlier. Scholarships is one big thing. So I think it was St. Louis that was able to get a hold of the St. Louis Medical Society and get scholarships to attend conferences. I think that's great. I think probably the Indiana State Medical Association would do the same if I contacted them about it. The Indiana State Medical Association started a fellowship just 2 years ago where they pay a medical student about $1,000 over the summer to just help the ISMA on just different policies that they find really interesting, and you're getting paid to do that. I think that's great. You can also schedule like a healthcare policy clinical elective in your 3rd and 4th year. That's something that I'm hoping to do this next month. But I have a buddy that just did it this past month, and he was at the state legislature every day with some of the lobbyists for the ISMA, and I mean just learning kind of on the fly. Also, when I was trying to advertise the debate that we had in October, I contacted the ISMA and asked if they wouldn't mind putting it in their newsletter, and they were more than happy to put it in the newsletter, and I really think that helped kind of get some physicians to turn up to the debate. So, I mean, the State Medical Association, I mean, they're looking to help medical students out when they can. They're trying to really promote healthcare policy for physicians, and so when you have an event that's on the Affordable Care Act, like in a debate on top of that, I think they're all about that. So my conclusion is your state medical association is a great place to get involved if you are interested in healthcare policy. You'll get great experience. You'll be able to get some great networking in with local physicians, and possibly have an impact in your state legislature. Also, physicians are excited to see medical students at these events. Like Dr. George was talking about earlier, if younger medical students aren't getting involved in healthcare policy, a lot of these medical associations are going to die at some point, and if physicians aren't involved in policy, that just leaves politicians to be making, or deciding what's going to happen in healthcare in the future, and physicians are the ones that are seeing the patients. Physicians have a better idea of what needs to happen in healthcare policy, and so we just got to make sure that we're, keeping these things in mind and trying to stay involved in healthcare policy. Another shout out to Chad Curtis. He's a secretary for the MUCOM chapter, and he's also been very involved in the ISMA. He actually was a national delegate for the AMA. He kind of took it to another level. He took it to the national level, and he's been very successful in everything he's been doing as well. But that's really all I have. Thank you for your time.